Diabetes was considered disease of affluence, which means only the rich will get. You go back to the Bollywood movies, Stage बैठे हैं सोफे पे, or some businessman with a paunch and he has died. Now it's not like that. It's not only a particular section of society. In fact, it's affecting all sections of society. I frankly don't know any healthy biscuit which is you can buy off the shelf. A lot of my people with whom I see for diabetes, my patients will say, "Sir, we bought this because it says it has oats." But then you turn around, it'll say 1.6% oat, and the rest is refined flour. The way some of the things are marketed can be misleading. That's where we need to create the awareness. So a lot of people think Jaggery is very healthy, but someone with diabetes taking Jaggery, thinking that replace sugar with Jaggery, that's not right. Why? Because Jaggery also will cause sugar spike. In terms of sugar spike, Jaggery and sugar are almost equal. Good that you also mentioned these sugar substitutes, stevia and monk fruit. So both of them are 0 calories. It's important to prevent first of all. Prevention is the key, and prevention should start very early. Let's talk about kids. Even before that, nowadays a lot of theories, a lot of from the fetus itself. Even before that, even before conception, a lot of young ladies now, we all see infertility is increasing. So the mother's weight prior to getting pregnant is also important. All these factors are counting it. So the healthier the parents, we transfer those genes to our next generation. And more importantly, we should educate our kids what is nutrition, what is healthy food and healthy diet. We have to start at the basic level. Once you have pre-diabetes or diabetes, everything changes. Somebody who comes with a deranged report to me, my approach would change. If someone has normal reports, he doesn't need to come to me. He doesn't need to see a doctor. What he needs to do.
Hey everyone, this is crave, your host. I'm a wellness mentor and have been coaching people to experience genuine well-being for almost a decade now. These conditions silently affect millions for years before the symptoms even appear. Why do some people develop blood sugar issues? What can we do to prevent them? To help us unpack this, I'm thrilled to be joined by Dr. Rahul Baxi.
Thank you so much, Adil.
Now I have a very honest question. Why do I feel the desire of eating sweet, especially after eating a meal?
Yeah. So, what happens is when we eat carbs, in simple terms, when you eat carbs, your sugars will spike up a bit. When your sugars spike up and someone who doesn't have diabetes, the pancreas will release some insulin. Okay, the signal goes there to the beta cells. That insulin goes into the blood, and that sugar which is high, it brings it down. So slowly we mentioned about insulin resistance.
Yes.
So what is insulin resistance? I'll try and explain. Say, sugar. The door is not opening because the door is locked. So insulin is that key. So my pancreas will produce insulin. It will give you the key. It will open the door and the sugar will go inside. Sugar goes inside. So your blood sugar comes down because from the blood it has gone inside the muscle and the cells. And your sugar is also normal and your cells are happy. Muscle is happy that they got energy. Now, slowly what happens if I'm not exercising? If my weight is going up, the lock, which you remember, the lock starts getting rusty. The lock is not that effective, which means when again I eat something, sugar goes up, sugar is trying to go inside the door, but when the insulin comes, that insulin key is not working now. The door is not opening. But I have already eaten something. What will happen to the blood sugar? It will go up because the door is closed. Inside my cells are also feeling weak now. They're feeling tired. Hey, give me sugar. I want energy. Okay, sugar here is also waiting to go inside. But that one key is not working. So what my pancreas does, it's seeing that, okay, this one key is not working. Let me send some more insulin to open the door. So pancreas starts overworking. Okay, so my insulin levels also go up. So here the sugar is going up, and someone who doesn't have diabetes still, but the insulin levels also go up. And it's sending more insulin, and maybe that 2 or 3 keys together may open the door today. But that lock is still getting rusty. Today the door opened and then suddenly the sugar went in. My cells felt some relief. Now slowly over a period of time, I'm still not exercising. I'm still, gaining weight. Again, the same thing. I eat food. The sugar goes up. Pancreas, again, the lock is not opening. Pancreas is producing insulin, producing, but still now the lock is not opening. That's when the high sugar and the cells are so tired now, they will get so fatigued. So you start having this fatigue. And because of the high sugar in the blood, the sugar can't go inside. So what it'll do, it'll go out through your urine. Okay. So then you start peeing every 1 hour, 2 hours, because now the body is trying to throw out the sugar through the urine. And when you start peeing, sugar goes out and water also goes out. You start feeling thirsty. So you drink more water, then again you go to pee. So these are some of the symptoms because of insulin resistance, which happened because I'm not active, I'm not exercising, and I'm not allowing the sugar which needs to go inside the cells to go there and act. So this is what insulin resistance is.
So when we eat foods that are either rich in fiber or are rich in sugar, they have a different impact on the blood sugar levels. Can you please help me understand how does it impact the blood sugar levels and what is the idea of the good and bad sugar?
Yeah. So that's a very important question to understand. And nowadays, see, one thing I'll say at the start, we have these new technology which is called as CGM.
Yes,
You heard of it? Continuous glucose
glucose
monitoring.
monitors.
So these sensors are used very often with a lot of our patients who have diabetes and a lot of people who are just conscious about their health. They are also using these sensors. Why that is important? Because what question you asked about glycemic variability,
Yes.
or good and bad glucose patterns, that is the sensor. That technology will give you the answers to this. So just to explain this, when we eat food, our sugar spikes.
Yes.
Someone who is healthy, who does not have diabetes, the sugar would spike a bit, but then come down very fast. Why? Because their pancreas is working, because they are active, they're exercising. So the sugar won't stay up for a long period of time. It'll come down very fast. Compare this to someone who has pre-diabetes or diabetes. In someone who has this, if the sugar spikes, it can stay high for a longer period of time. That is what causes organ damage. For a high sugar for a period of time can cause organ damage. So this is the difference between the different sugar patterns what you're asking.
Spike. What causes a longer glucose spike, if I may ask?
So if your body is not able to utilize that sugar well, what utilizes this sugar well, your insulin production from the body has to be good. You need to be active. You must not have insulin resistance. Your insulin sensitivity should be good. And of course, the type of diet you consume also will affect that. So what you eat is very important, and how active you are is also very important.
For someone who doesn't have the facility to have a continuous monitor, are there any signs that that will enable us to understand how is my glucose? Is it
Yeah.
good or not?
If someone's sugar is rising, say someone has pre-diabetes or diabetes,
Yes.
what is the commonest presentation? It's asymptomatic, which means a lot of us may be having diabetes today or pre-diabetes, but we will not know. Why?
Yes.
Because there are no symptoms. I'm
Okay.
healthy, I'm eating well,
Okay.
I'm sleeping well, I'm active, I work whole day, I don't get tired. Because initially high sugar levels, say pre-diabetes or even diabetes levels, patients may not have any symptoms. That is why they call diabetes as the silent killer, right? Because it's silent, and then suddenly that high sugar may cause eye damage, may cause heart damage, may cause kidney damage. We have patients who sometimes suddenly come to the hospital with chest pain.
Okay.
We do an ECG, find they have heart attack. And then when we ask them, hey, do you have diabetes? They say, no, we don't have diabetes. And when you check the sugar, it's 300. When you send the HbA1c, which gives you an average 3 monthly sugar, it'll be 8, 9, 10, 11 something. So what that means, patient didn't get diabetes that night. He got heart attack that night, but that diabetes was already there for probably few months or even years. But he didn't check because he didn't have any symptoms. So that's one part of it, that most commonly it can be asymptomatic. But when sugars are very high, they keep climbing up slowly, or a period of time. Sometimes patient can have some symptoms. What are those symptoms? Patient can feel thirsty, want to drink water every time, every 1 hour, 2 hours. They go to pee every 1 or 2 hours. At night, you ask them, they go to toilet 3 or 4 times at night.
Even if they drink less water.
Yeah, because the sugars are high, and the mechanism of the body to throw out that sugar is through the urine. So the body is just working to throw out that excess sugar in the form of urine. But when they pass urine, they will feel thirsty. So that's why they'll complain of dry mouth, parched throat. Some patients or some people think that it's normal, and they start drinking colas and drinks. Yes. Because they're so thirsty, and that gives them some kind of relief. Yes. Because they don't know they have diabetes. So those sugary drinks give them a very
satisfying
very
feeling.
satisfying feeling. Exactly. So that can be one symptoms. Few other symptoms could be feeling fatigued, tiredness, irritability. Sometimes family members say, "Ki, Papa bahut chidchide ho gaye hain." Yeah, family member is very irritable. Yes. That can be one important symptom of diabetes. Poor wound healing. So some patients, they have some injury over their toe in the leg. And it's not healing. They go to the doctor 5 days, 7 days, 15. It's not healing. They've taken antibiotics, and it starts, getting infected. Then maybe the doctor says, okay, let's check your sugars. A lot of doctors would check the sugars very early in that stage. Yes. But if not done, then when you check the sugars, you'll find that person has diabetes. So these are a few symptoms of diabetes at different stages.
You mentioned that whenever a patient comes, that you do screening that if the individual has diabetes or not. Wouldn't it be wise that people start doing health checkups before? I mean, it's not necessary that you need to have a problem and only then you check your blood sugar levels. How about the idea that we have this habit, maybe like 6 months or a yearly, that we do blood tests?
Absolutely. So that's again important. And nowadays there are guidelines. Okay. Some of the Indian guidelines say if you are above 30 years old of age, you must check for diabetes at least once. and then maybe depending on the levels every 1 to 2 years.
Okay.
That's one. But say you are younger, say you are 20, do you need to check? So then there are some parameters which you can look into. Whether if some 18-year-old comes to me or 20-year-old comes to me and asks me that should I check my sugars, how would I decide? So exactly. So there are some risk factors which will decide whether a younger person should check or not. So if they are overweight or obese, or if they have strong family history of diabetes, or if they have some other related comorbidity, which means some other illness which is related to diabetes, like if they have blood pressure and if they are overweight, if they have deranged cholesterol levels, if they have something called as obstructive sleep apnea, which we call as OSA. People snore and the quality of sleep is not as good as it should be. So there are some other markers or some other risk factors which can decide whether we need to check early or not. So if you are an adult and if you have any one of these risk factors, you must check for diabetes. Else, above 30 or when you're older than that, you must check for your sugar levels regularly.
Interestingly enough, 20, 30 years back, the idea of diabetes was not so prevalent, especially in youth. When I say youth, I mean like around 30 or 40. 40 is also very young. The frequency or the number of people who are having diabetes below 40 has increased in the last 1 decade. Would you agree to that?
Exactly. And you talked about 30, 40 years. So I'll tell you something. So say 30, 40 years ago, diabetes was considered disease of affluence,
Okay.
which means only the rich will get it.
Only the rich will get it,
You know,
yes.
And you go back to the Bollywood movies, you open up anything, you'll see एक सेठ जी बैठे हैं सोफे पे या गादी पे, or some businessman with a paunch and he has diabetes. Now it's not like that. It's not only affecting a particular section of society. In fact, it's affecting our all sections of society, and even the poorer people it's affecting. Why? Because in the past 1 or 2 decades, our lifestyle has changed a lot. Our dietary patterns have changed a lot. We are not as active as we used to be. Look at the transportation. People say कि when they eat some laddus, for example, कि अरे मेरे दादाजी भी वही खाते थे. My grandparents used to eat this. Why not me? Why can't I have rice every day, or why can't I have this kind of a diet every day? It's not wrong to eat, but then how active you are. That is what decides what illnesses or what chronic conditions you will get.
So, since the number of people who are having pre-diabetes or the diabetes in general has increased a lot, what are some of the key actions that an individual can take? Considering you already mentioned movement and nutrition, please expand more on that. And also, if there are any other actions beyond that which can enable an individual to be away from diabetes as much as possible.
Yeah. So, see, it's important to prevent, first of all.
Prevention.
Prevention is the key, and prevention should start very early. So, let's not talk about the youth. Let's talk about our kids.
Kids, yes.
Or, even before that, nowadays, a lot of theories, a lot of studies being done that
exactly,
from the fetus itself.
Yes.
Even before that, even before conception. So, the
Yes.
mother's weight
That's
prior to
amazing.
getting pregnant
Yes.
is also important. We get a lot of young ladies now. We all see infertility is increasing.
Yes.
People are getting pregnant at a later age,
Yes.
and so all these factors are counting in. So the healthier the parents, we transfer those genes, we
Yes.
transfer those things to our
Yes.
next generation. So that is again important. Again, so then now talking about kids, once they are born, they will eat what we eat, of course.
Yes.
Once they are growing up, so that's again important. What food we keep at home, what's kept on the dining table, what's kept in the snack shelf, and so on. Then going to school, how healthy the food in the canteen is. Are they selling junk? Or you come out of schools, sometimes you see these Chinese bales, which is full of color and MSG and salt,
Yes.
sold out of school. You see candy floss
Yes.
sold out of school, outside school. So some of these simple things we must try and regulate. And more importantly, we should educate our kids what is nutrition, what is healthy food and healthy diet, so that as they grow, because we have to start at the basic level. Once you have pre-diabetes or diabetes, everything changes.
Yes.
Somebody who comes with a deranged report to me, my approach would change. And if someone has normal reports, he doesn't need to come to me. He doesn't need to see a doctor. What he needs to do is just maintain a healthy lifestyle, eat healthy, exercise well, and keep monitoring. That's it. So as we grow, our metabolism also changes. So we need to make those changes in our body as well. We need to eat healthy, and as we just mentioned, they should start at a very young age. One more important thing, talking about school, I feel it's important to study nutrition, and it's also important for our youth to start reading food labels. It's very, very important because nowadays, the food label on the front would say sugar free, for example. But you turn it around, it might read it has, say, refined flour, it has palm oil, it has no sugar, of course. But there are some other ingredients which may not be as healthy as it's projected to be. So it's very important for us to understand that, and it can be only done from a younger age. And going further, if someone comes to me with pre-diabetes, my approach would change. Basics would remain the same. What we need to do is they need to make changes in their lifestyle. So to make changes in the lifestyle, first of all, we as medical professionals, doctors or nutritionists, whoever seeing the patient, has to understand what kind of lifestyle the person is leading.
Yes.
Only then you can make changes. It cannot be one size fits all, or it cannot be that someone from, say, Bengal comes to me, or someone from Gujarat comes to me, or someone from the south comes to me. So my approach would be very different. For example, if somebody is from Bengal, I can't ask them to stop rice.
Exactly.
They've been eating rice at least 2 times a day
Yes,
for all their life. Could be 20, 30, 40, 50 years. So to them, kare rice mat khao, that is not the right approach. So first of all, to have a balanced approach, to advise them according to their cultural norms and according to their own likes and dislikes, goes a long way in success, because a blanket statement or one size fits all diet will never work in such people.
Amazing. You just mentioned about the idea of understanding labels, right? I know protein, I know carbohydrate, and I know fiber a little bit. Maybe some people know sodium also. What are the other things that an individual should look? So if I go to a supermarket, or anyone goes to the supermarket, what should I look for?
Yeah. So some basic things what I always tell is, for example, biscuits.
Okay, yes, common idea.
So I frankly don't know any healthy biscuit, which is you can buy off the shelf. Frankly,
Yes.
a lot of my people with whom I see for diabetes, my patients will say, "Ki, sir, we bought this because it says it has oats."
Yes.
But then you turn around, it'll say 1.6% oats.
Yes.
And the rest is refined flour.
Yes.
So the way some of the things are marketed is can be misleading. So that's where we need to create the awareness. So, and some simple things is, if you see refined flour, if you see palm oil, if you see sugar, if you see Jaggery, and if you have diabetes, I'm saying, not for everyone. If you're healthy, if you're young, if you pick up 2 biscuits now, nothing will happen. But I'm talking about someone who has diabetes, somebody who is on medicines, somebody who's trying very hard to lose weight, somebody who has blood pressure. For them, it is important to run away from these ingredients, which is refined flour, palm oil, sugar, Jaggery. Because the people don't count this. People would say, "Ki, do biscuit khaya tha," or it is healthy biscuit, or it is sugar free. So first of all, they're consuming something which they shouldn't. And second thing is, it's not registering there.
Yes.
They're taking that as a healthy stuff.
Yes.
So that it is double hit there, basically.
You mentioned the two words at the same time, sugar and Jaggery. While as a lot of people understand that, oh, Jaggery is actually very good for you, it's natural, it has minerals, etc. And then now we have stevia, and then we have monk fruit also. Are they all good, or are they all bad?
So a lot of people think Jaggery is very healthy.
Yes.
So I must mention here that if you're healthy, if you're young, if you do not have diabetes, and you want to replace sugar with Jaggery, fine, go ahead. But someone with diabetes, taking Jaggery, thinking that they will, replace sugar with Jaggery for all their 3 or 4 cups of coffee or tea, that's not right. Why? Because Jaggery also will cause sugar spike. In terms of sugar spike, Jaggery and sugar are almost equal. Good that you also mentioned these sugar substitutes, which stevia and monk fruit.
Yes.
So both of them are 0 calories, first of all. So if you add it to your beverage, it will not spike your sugar, because they have sugar, and you'll feel sweet. They'll feel sweet to you. So a lot of patients are preferring that. But then again, some people do not like the aftertaste. Some people prefer without sugar or Jaggery, or without any. Yeah, exactly. So I'll allow my patients to. So when they come to me, and again talking about someone who has diabetes or pre-diabetes, my first advice is, okay, let's try and avoid first. And usually what my experience and a lot of my patients have told me also is that it takes around 3 to 4 weeks to settle into that.
Yes.
Exactly. Yeah. So if that works for you, good. But then some would say, sir, I take only 1 or 2 cups of tea, I want some sweetener. Then I'll allow them with some stevia or even monk fruit sweetener. That still works. But then it is important to understand, especially those who think Jaggery is healthy. It may have some minerals here and there, but
essentially it's the same.
exactly. So
Where does honey take a place in the hierarchy?
it will spike sugars, no? So I still remember in the hospital, I was rounding, and this patient was admitted with some surgery, foot surgery done. I was giving him insulin, I was giving him medications, and still the sugars were not coming down. And I was just wondering what's going wrong, because the diet is controlled in the hospital. Our dietitians look after the patients. The food comes from our hospital kitchen as well. And so then, around the desk, I opened the desk and I found a honey bottle there. So what the patient said, someone told him, take 2 spoons 2 times a day and it will help you because you have diabetes. So, stopping that. So just to highlight, honey also spikes your sugars. So a lot of maple syrup for that matter.
Yes.
So these things will spike your sugars. So, you can take them if you want, but then again, if you have diabetes and, don't take them if you think they are healthy or they are doing good to your sugars.
Dr. Rahul, there is a trend nowadays that we are noticing that people are working crazily for the weekend, and the moment weekend comes, they start eating a lot, going to parties, drinking a lot. Does this 2 days of eating, does it have any impact on our body or not?
Definitely yes. So see, when you want to stay healthy, it's all about discipline, and it's all about sustainable discipline. So it's not that we see people who work very hard for 2-3 months. Someone who wants to lose weight, go to gym, exercise, be very strict with their diet, and then after 3 months they'll just leave it. So they'll lose say 5 to 7 kg, and then again gain back 6 kg or 8 kg.
Yes.
So that is very common. And talking about your question specifically about weekday and weekends, I'm not saying don't enjoy your weekends. And again here, we have to differentiate between someone who's healthy and someone who has diabetes. My answer would be different. So now we're talking about someone who's healthy, and who wants to stay healthy. Of course, you go out on weekends. Of course, you enjoy. But the key word here is moderation. You can't just go out and eat this also, eat that also, drink this also, and so on. So if you apply moderation to that, I think you can sustain over a longer period of time.
And how does one understand that, okay, I need to stop?
So as I mentioned initially, you remember the silent killer thing?
Yes.
And you remember I mentioned asymptomatic.
Yes.
So see, initially, even if you have a bad lifestyle, for example, you're not exercising, you're busy with work 14 hours a day, your sleep is not good, and diet also is everything outside and a lot of carbs and refined flour and packaged stuff and outside stuff. So maybe your sugars are rising, maybe your weight is going up a bit, but you will not realize that. So, but at the same time, if you look for markers, if you're feeling fatigued, you feel tired easily, your sleep is not enough.
Yes.
Exactly. So those might indicate that you're getting into trouble. And then what you need to do, you need to do your blood test, you need to do your workup, maybe approach a doctor, and then just see what's the cause. It may not be diabetes, it may be cholesterol levels, it may be your hemoglobin is down, it may be thyroid. There are a lot of other things. So when, especially then you'll see that when we do test, we don't just do one thing for a symptom, because we do a full panel, so that we need to pick up what's going wrong. It could be vitamin D deficiency. You could be deficient in vitamin B12.
Yes.
Okay, so a lot of things, and sometimes it may be a combination of all of these. You may have diabetes, blood pressure may be a bit high, cholesterol may be deranged, and you may have vitamin deficiency, which is the commonest scenario I come across. It's not just one thing. So then we address everything together, along with lifestyle, and if that doesn't work, and if medications are required, medications. So important for the younger people watching this, that if you're sleeping less than 6 hours a day, the risk of you getting diabetes is much higher. Sleeping less than 5 hours, it is even higher. A lot of people in India today don't know they have pre-diabetes or diabetes. So that's a very big hidden burden, I should say.